Hello, everyone, and welcome to our new normal. So, how's your new normal, Jackie?
Oh, this week I'm excited for our weekly rant. I look forward to these every week. My new normal's good. I have switched up a little bit of my weekly schedule. My new normal has switched to include a lot more healthcare, which we're going to talk about. I think this week alone, it's a Thursday we're recording this, and I've had a total of 8 different healthcare visits this week.
Wow.
So we'll talk a bit more about that, and I just realized where was all my time this week. So I think I'm into a new normal.
Amazing.
Yeah. It's not where I thought I'd be spending my time. I want to get to the gym more.
Yeah.
So that doesn't include my workouts.
Yeah.
That is just visiting healthcare.
Yeah.
A variety of different healthcare specialists. But I'm also going to say I'm really fortunate.
Yes.
So it's not all bad. It's my new normal.
Always good to have that gratitude.
Yeah.
Yeah.
How about you? How's your normal this week?
So quite good. Like started to focus a lot on fitness. So I added a new regimen to my fitness routine. So it's about weighted walks. So weighted walks is like you have a weighted vest, you put it on, and you just walk. So it adds a little bit of rigor, and it's included as a strength training exercise. So I've started doing that. So every weekend I have a weighted vest, like it's around 10 kgs, and then I just walk, right? So 7k on a Saturday, 7k on a Sunday. Now the reason behind doing that is fitness is very important,
Yes.
right? So we'll talk a lot today about health, but if you're not fit, then it has consequences on your career. It has consequences on finances. It has consequences on quality of life, on marriage, on being an example for your kids.
All relationships.
Right? So it's important to stay on top of your own health. So that is a good segue into our today's topic, healthcare.
Yes, one question though.
Yeah.
You bought weights as opposed to a good outdoor backpack? Because I know you've got them, like one of those big backpacking backpacks.
Yes.
So you decided to go for the weights. Are they better?
So it's a weighted vest, so it is more snug. So I was reading a lot about it. Backpacks may shift, right? So it is a different, it's good for hiking and stuff, but shifting of weight, right, can create some injurious conditions. But when it is very snug, right, there is no chance of so it's the weight is more distributed on your body.
Okay.
Yeah.
That's good to know. I'll make a note of that.
Yeah.
Good.
So for people who are new to Canada, who are students, who might not be aware of it, how does healthcare work in Canada?
Well, one of the hallmarks of Canadian life is our healthcare system. And when I've traveled around the world, especially over the last 10 years, people always bring that up with me. Oh, you live in Canada, you've got great healthcare, etc. And we do. And do you know the history of healthcare, Harry? Do you know how this all came to be in Canada, actually? Because you weren't raised here either. And now you're a new father, so this is important. Well, first of all, the father of healthcare was Tommy Douglas, who was the premier of Saskatchewan. And I believe he was a member of the NDP at the time.
Wow.
And different parties way back when. But he took on the challenge of making sure and wanted to fight that for the healthcare and access to healthcare for all Canadians and remove all barriers, particularly economic barriers. Now that, I believe, started back in 1947, because I was doing a little bit of reading in preparation for our rant this week. Then I was curious too, because I know about Tommy Douglas, but it went back to the mid-1940s, and it was after World War II, right?
Yeah.
After the Great Depression, the war, people were settling down, trying to get back into good quality of life, and so he took on that challenge. I don't believe it became the Canadian Health Act. Did not come in until the 60s when it was adopted more thoroughly across coast to coast of Canada. But it was Tommy Douglas back in the mid-40s from Saskatchewan that really took this on and started the healthcare, the quality of life metric that we use as part of our Canadian existence, I guess. I also have friends that grew up in the States that saw what happens when you don't have access, equal access to healthcare. So, and so I've had conversations with them over the years as well, and it's very different. So it's something we can be proud of.
Wow, so we have Saskatchewan and NDP to be thankful to,
Yes.
right, for our present like healthcare system.
Yes.
So like just to like give a quick, we are going to talk about it, but for people who are very new, right? So if they get sick or if their family members get sick, right, is healthcare free?
Yes, for essential services.
So healthcare, for
yes.
people who are new, healthcare in Canada is free for all essential services.
Yes. So if you are in an accident on the side of the road,
Yes.
your child has an asthmatic attack in the middle of the night,
Yes.
and you think about terrible accidents that get triaged with lots of blood or problems breathing,
Yeah.
etc., you will be taken care of in our emergency system or in urgent care,
Yes.
which is another level of care that we have, as well as primary care physicians. But you will be triaged, so that's something else. So I do believe today, I feel very comfortable that if I was in a terrible accident or needed emergency surgery, I would be cared for. So would you, and so would your children.
Wow.
And that your family members. So I just wanted to make sure you knew that it was about essential services, what they would deem essential.
Okay. So that's a good segue. So you have lived in Canada for almost 60 years now. So how was your interaction with the Canadian healthcare system?
Well, I remember as a child, born in the mid-60s, being in the hospital quite often. So, or I feel it was a lot actually, but maybe it was normal, I'm not sure. But I had a few eye surgeries growing up. I had tonsils and adenoids. I did have to have tubes in my ears. I had a small hearing impediment when I was young. And I don't ever remember being turned away or there ever being
So they never turned you away?
No. And I grew up in I would say a lower middle class single parent household.
So that's important context here, because like you didn't come from wealth, right? But
No.
you still had good access to healthcare.
Yes,
They
absolutely.
never turned you away.
No.
Wow.
Yes.
Please continue.
Oh, that's a good point, because friends of ours, as you know, have shared those stories with us. I had a lot of athletic injuries. I had bones x-rayed and so forth, and was always, I remember, well cared for. And even as I moved up into my adulthood, and always, wherever I lived, had family doctor.
Yes.
Even when I went to university, we had medical clinics on campus.
Yes.
And have had different surgeries and medical issues as adults, and even had 2 babies.
Yes.
So I've seen the full gamut of the healthcare system, both helping support our physical health,
Yes.
but also our mental health.
Yes.
So that was another important piece about, I think, Tommy Douglas's vision was about access to healthcare in the broadest sense for the whole person. So mental health supports, physical, so not just being able to have our bones x-rayed, but also being access to other services.
And just to double down on certain things, so like you just mentioned that as a student you had access to healthcare on campuses. So if you're a student in Canada, do check with your campuses. They do have healthcare services present, right? Where we work, we do have that.
Yes.
Then the second part you just briefly mentioned, like you being a mom to a kid, right? So how was that experience? Because a lot of women will have that consideration in their mind, right? Like
Yes. I think I had great obstetrical care. I had 2 obstetrical emergencies and great care under both of them. One of the things that I wanted to bring up, Harry, that was different over the last 20 years of healthcare in Canada is that we used to pay a provincial premium.
Yes.
I wanted to bring this up in the context of the story I'm going to share with you. That in the different provinces have, I think, some healthcare premiums, and we had them in Alberta too.
Yeah.
And then they were removed a number of years ago.
Okay.
So we used to pay, I think, $68 a month for our children and for ourselves. And that was really normal for me, having come from another part of Canada. Different employers pay or individuals pay. But in my mind, I always knew wherever I traveled in Canada, I would be covered.
Yes.
So my son Benjamin was born in Vancouver. I think you know the story. Emergency surgery. And I remember...
He's an amazing kid, by the way. Yeah, he's traveling the world right now.
Yes, he is. And they came in and asked me what province I was from. I said, Alberta. And the nurse went, oh, great. Okay, phew.
So you are from Alberta, but you were not in Alberta. You were in BC.
Yes.
Yes.
So I said, well, what would it have mattered what province I was from?
No.
And they said, well, depending on what province you're from, it depends if we bill because of the reciprocal health care that we have in Canada. So not all provinces participate in the reciprocal health care, which is part of our Canadian system. So if I'm an Albertan traveling to BC, my cost for my health care in BC would be covered from the province of Alberta. Or from the Canadian. And to be honest, I'm not sure exactly how the transfer payments happen, but I'm taken care of.
Yeah.
But they said if I was from Quebec, it would be different for them of how they manage the billing. And the physician, I was a little surprised, and so I turned to my doctor at the time and said, would I have been cared for?
Yes.
He said, absolutely, I would have done the surgery.
Yes.
However, it's just easier.
Wow.
And I remember being quite taken aback, Harry, because I had never seen or had it explained to me like that before. Because the province of Quebec runs their own provincial healthcare program. And it's separate. They don't participate in the reciprocal healthcare system that we have. And that's just something to remember when we're traveling.
Yeah.
If you're working and or say you're not working, or you're a student with your... Make sure you have travel insurance, depending on where you're traveling in Canada. But by and large, you will be taken care of. But that was my first experience as a parent, thinking, oh, okay. Well. And to be honest, we were repatriated back to Alberta with Benjamin after he was born.
So you had to move, after the pregnancy happened, you had to move from
the delivery
BC to Alberta.
And I was covered completely. They repatriated families.
Cover the travel and everything?
They moved me back to Alberta.
Yeah.
And then with Benjamin. And then they moved another family with their baby from Alberta back to BC. So they didn't deadhead a flight. So the two provincial governments organized that and moved us, which was really special at the time, I remember.
So for the entire pregnancy, like going into the hospital, like maybe the checkups before that, the flight back to Alberta because you delivered in BC, right? The whole thing, how much did it cost you?
Oh, it didn't cost us any out of pocket.
That is very important.
It was already covered through our healthcare system.
So, like maybe people who are new moms or like who are pregnant right now, it's a peace of mind, right? They do not have to worry about the cost.
Yes. I do think that was a unique situation. I wouldn't travel when I was pregnant, even in Canada, without extra health insurance.
Yes.
However, that's possible to get.
Yes.
And so I think every situation is unique. But in Canada, when that happened, and I was not at home in my home province, I was completely taken care of. And for a couple weeks too. It wasn't 3 or 4 days. It was a couple weeks. So I'm always grateful, because I will say that at the time for that trip, Ben's dad and I thought we would go to California maybe for a weekend. It was my last weekend I could travel.
Thankfully you didn't go. Yeah.
Absolutely.
Yeah.
I'm not sure how all of that would have worked out, but I do know it would have been an incredible financial stress. And I might not have been covered fully. I don't know, but we
Yeah.
decided to stay in Canada, and we ended up having Benjamin in Vancouver. But we were completely taken care of, and I'm always grateful for that.
And like just to add on to it, it's a peace of mind, right? Like
Yes.
means coming from a different country where healthcare is paid, it people file for bankruptcies because of medical debt. Right, it happens all the
Yes.
time in United States and all across the world where socialized healthcare is not there. So we are fortunate to have socialized healthcare because you might not have to file for bankruptcy because of medical debt out here. So
Absolutely.
it gives you a peace of mind. You're more freer, right? Because you know that someone is going to take care of you if you fall sick.
Yes.
Yes.
And even when you are a student in Canada, you have access to extended health care through your student
Yes.
registrations. As self-employed individuals that might not have an employer support network like a benefits plan, you can also buy extended health care.
Yeah.
And in Alberta, we no longer have our healthcare premiums.
Yes.
So that is taken away as a cost in this province. But in
Yeah.
other provinces, they might have those healthcare premiums that help support that socialized medicine. However, we still have access to a lot of essential services. And we're even seeing, and we've talked a little bit about this, some privatized healthcare and two-tier systems starting to come to Canada
Yes.
in a variety of ways. And so I've had some exposure to that as well. But can I go back to India? When you grew up, you didn't have
No.
socialized medicine
So-
or vaccine records or anything. Is that
Yes.
correct?
So India has some kind of socialized medicine. There are government hospitals, right?
Okay.
Where like most of the medical care is free, right? But it is because of the population size, the services are not enough. So people also have access to private, right? Private healthcare. So just like sharing my experience, like
Yes.
I had a like deeper interaction with the healthcare system in India because back in I guess 2014, my dad had a heart attack
Okay.
and he had to be rushed to an hospital, and then like we had to do an angioplasty, so that everything was paid. So you have to pay for medicine, you have to pay for test, you have to pay for the surgery, and you do have to pay for the aftercare too. So coming from that system, Canadian system is very different for us, right? Because here you don't pay for those services. You don't pay for like emergency care. So if the same thing would have happened here, everything would have been taken care of.
Mm-hmm.
So that's a different world for many of us who come from different parts of the world.
Okay.
Yes.
And as you have worked in Canada, you've always had an extended healthcare plan with your
Yes. With the
package of
employer.
employment package,
Yes.
right?
Yes.
So I want people to remember that that's part of your compensation, and it is an important consideration when you're shifting careers or getting
Yeah,
your first job.
and-
We have so many students that we work with,
And
right?
just to share, because you brought it up, like when I came to Canada, right? Initially, the employer provided insurance for first 2 months because it depends on province, right?
Okay.
Not all provinces cover you right away. Even if you're a permanent resident, I was a permanent resident when I traveled, right? But not all provinces cover you right away. So if you are a permanent resident or student, you might want to take some healthcare, some health plan, some health insurance, because you might not get coverage right away. You have some waiting time. Alberta, I don't think there is a waiting time, but in Ontario it was 2 months. So first 2
Okay.
months you have to wait without health insurance, right? If anything happens, you have to pay out of pocket, right?
Yes.
Yes, so that's very important for people
So it's
to understand.
So just remember, if you're traveling, to make sure you check what
Yes.
those requirements are from a healthcare perspective.
Absolutely.
Right? Okay.
Now,
So-
just continuing, like
Yes.
that was the past, right? It means you had very good interactions, like from 20s, early 10s, 20s, 30s, 40s, 50s. How is the present situation?
Well, Yeah, I was thinking about this week. I'm really fortunate in that my family and I have had the same family physician for 26 years.
So same family doctor for
Yes.
26 years.
Oh, yes.
Yes.
Very fortunate to have that. That is very unique today because I do recognize that expectation of having a family doctor is not the normal today, the norm. Because I do have friends that have moved to Alberta or have moved across Canada and they're having trouble finding a family physician. Because what was your experience?
Absolutely. So for first 2 years in Alberta, we didn't have a family doctor, right? Me and my wife. So like there are wait times like for family doctors. Most of them are not taking new patients because it's already
full.
overloaded.
Yes.
Right. So it's a big hassle to get a family doctor. There have been reports even in media that there was an Ontario, like rural Ontario clinician who declared that they are taking on new patients, and even in minus 30 degrees like snowstorm, people were lining up, right, just to get a physician, just to have a family doctor. And without a family doctor, it's very hard to interact with the system because fortunately I didn't get too sick, right? But whatever interactions I had, there is a family doctor at our university, so there is a physician at our university that helped. But I'll tell you one instant where it really hit me hard. So my wife was pregnant. We didn't have a family doctor because we moved to a new location. The old family doctor moved out, so there was it was a gap, and we were searching, but we were on wait list for few physicians. So she was pregnant and she got food poisoning, and I got food poisoning too. So we were both vomiting our hearts out. Now what do you do? Because we don't have a family doctor. So where do you go to for medical care? So in that situation, I drove her to an emergency care hospital. Now in an emergency clinic, they judge first whether it is an actual
Triage.
emergency. They
That would
triage
be-
it. That's
that would be the word.
Triage
Yes.
it, right? So how severe it is? What is the severity? What is the pain level? Right? What is the chance of death happening? Right? So they decide all of that. They look at all of that. And unfortunately, in those parameters, we were ranked quite low because it was just food poisoning, right? So we had to wait. So if anyone who is more severe than you comes, they will first take him or her.
Yes.
Right? So we had to wait. So in total, we waited 9 hours to see a doctor. And to be very precise, at least I during the wait time was actually not that sick anymore, right?
Supriya was.
Yeah, Supriya was. And these are stories all across Canada. People have been waiting for hours and hours and hours in the hallways, right, to access medical care.
Yes.
Right? Yes.
So one of the things I have seen a difference.
Yes.
And while I'm thankful I've had the same family doctor for 26 years, we in Calgary at least, and I can only speak to that and maybe the surrounding area, we have things like walk-in clinics.
Yes.
And we have urgent care centers and the emergency. And so I feel over the years we have started to adjust to using the different kinds of services, but not everyone knows about the urgent care centers versus
Absolutely.
the emergency. Because I did know once that Benjamin was hurt and we needed an x-ray. So I went down to the urgent care center instead of emergency about the triage system, but knew that he would get an x-ray.
Yes.
And whatever was needed, he would be
Yes.
properly cared for. And so, but not everyone that comes to the city or that we work with, or, especially our students, they wouldn't know about those different kinds of
No.
healthcare. We do have electronic healthcare records, so whatever is being seen with me goes on my electronic healthcare record. I have used the walk-in clinics periodically over the last 20 years. I have been to urgent care, I've been to emergency, and of course, I'm with my primary care physician.
Yeah.
And we have what's called the primary care network in Alberta. And in Calgary. So a lot of times my doctor will have a preferred method
Yes.
for me to follow if she is not available. And so it's really important to recognize that we have those different systems.
Yes.
But I also think for us as a society, we have to get used to that, because there used to be emergency or family physician. You didn't have all these other choices.
Yes.
I even have some friends that would go up to a surrounding area of Calgary to go to the urgent center, for instance, in Cochrane, because they live in the north part of the city and it's just easier to get to Cochrane.
Yeah.
So I believe we've got, while our system is challenged today, we have those different parts of the system that I think we're all getting a little bit more comfortable using.
Yes.
And so I've used them all, and different people in our network have as well. But for Supriya, when she was ill, being an obstetrical case as well, you did the right thing by going to emergency at that time. But you were appropriately triaged.
Exactly. So that's important for people to understand. Like, there are wait times in the healthcare system right now.
Yes.
Right? And there is lack of doctors. So my question for you, like, why is this our new normal, especially on the wait times and on the like lack of physicians? Like, what?
I think we're seeing a lot of changes with the medical profession. People leaving Canada, but I think the biggest issue that we have is the lack of maybe infrastructure. Particularly, I only know the Alberta experience.
Yeah, so I'll put up the stats for people to understand. Like, the health infrastructure is counted as number of beds available. So Canada's number of beds per 1,000 people is less than the OECD average. So most developed countries have higher bed capacity than Canada has. Same with doctors, same with nurses. So we have lower beds, we have lower doctors, and we have lower nurses than rest of the developed countries. Not all, but average, we are shooting below the average.
We're below the average. So I was going to say the other piece of that is number of operating rooms.
Yes.
And the other piece to this, which I believe is probably part of the trend across Canada, is the growing population. So our needs today are very different, I believe, than 20 years ago. So we have bigger wait times, particularly for knee and hip surgeries, and osteoarthritis crisis. I had pulled off a report off the system this week, reading about this. And so as we see shifts in the demographics, we also see a different pressure on the healthcare system. And so our healthcare system in Canada probably has not shifted to the shifts of our demographics either.
Those are great points, right? We have an aging population.
Yes.
So as you age, you use more healthcare. That is just a fact.
And I would say different healthcare too.
Healthcare.
That's what I'm experiencing.
And the second part is last 2 years we increased our population by 1 million, 2 million people. But did we add the same amount of doctors and nurses? The
Per
answer
capita?
is no.
I would say no.
No. So that creates additional pressures on the healthcare system, right? And I'll put the stats about the wait times. You're absolutely right. For elective surgeries, the wait times are significant right now. So just a good segue for your story, what has been your experience with the elective surgery right now?
Well, I'm currently facing a severe case of osteoarthritis. So I am waiting for a consult for knee replacement. And this has taken a few years to come to fruition, of which in that time, I had access to x-rays. I saw my family physician. I, as you know, had a couple bad falls and have recovered from those. But it turns out that one of my knees is not 100% functioning. Now, having said that, I have also recognized that while my case is severe, there are people a lot worse than me, but also a lot older. But as I research and worked with my doctor to figure out these options, and I said I wanted to consider knee replacement surgery because it's impacted my quality of life so much, my ability to be on my feet, and just the general fatigue that comes with dealing with chronic pain. Well, the wait times I've been given, and while it's important, I am not in a crisis.
Yes.
Has been 14 to 18 months for the surgical consult, and then another wait period to actually have my knee
So, like,
operated on.
probably a timeline of around 3 to 4 years. Like, if you look from
I would
right
say
now,
2 to 3
2 to 3 years.
minimum.
So that's very like new to people. Like, would be new to people who are not from Canada.
Yes.
Because in US or in India or like in any of the non-socialized healthcare systems, you pay, you get your surgery done. If
And you
go
would
to-
pay,
You
yes.
would pay. You go to Mexico, you pay, like you get your surgery done, right? Even in most parts of the world. But in Canada, because we have a socialized healthcare system, you have to get a consultation, book a date for getting the surgery done, and then you're triaged, right? Like you said, if someone who is more urgent than you comes, then they are preferred. So for you to replace your knee, it's almost a 3-year wait time.
Yes, and
Yes.
I have my family physician referral.
Yes.
If I didn't have that support, I'm not sure what I would have done. And so I think about some of my friends, family members who have moved here later in life and have some other challenges like this going into the system.
Yes.
Now, I say this as well, everybody, that if I had a car accident, I know I'd
Yeah.
be taken care of. However, today I have an ongoing chronic issue.
Yes.
I have worked since I was 15 years old. I have participated in our economic system and in our
Yeah.
healthcare system. I do want this fixed, except that I will be appropriately triaged. Now, just as we've seen in other parts of medicine,
Yes.
we start to see this two-tiered system coming in, even in Alberta and in Calgary in particular, because that's our experience. We have some practices that sprung up, and they were in the news a couple years ago, where you could pay a monthly fee and have access to a family physician, physiotherapist, there was a nutrition
Yes.
counselor, everything. And I think some of them are not operating today because they felt they were in violation of the Health Code of Canada. And so that would be interesting to look at that again, because some of those still exist. But however, at the time, if I remember correctly, they were found to be contravening the Canada Health Act because
Yeah.
it was something you paid for that people that couldn't afford it wouldn't have access to. So it was actually quite in defiance of what Tommy Douglas's vision was way back when. Now, having said that, my first knee surgery that I had, I was about 28 years old. I remember going in, I had a meniscal tear.
Yeah.
And when we finally realized surgery was my only option, they had to go
Yes.
in with it orthoscopically. I remember the surgeon back then telling me, now this was over 30 years ago, saying, well, we'll put you in the list for the surgery.
Yeah.
I operate 2 days a week. Or if you want to do it next week, it'll be $1,500.
Wow.
And I remember thinking, I can pay to have this done. Now, back then, $1,500 I didn't have access to. I probably
Yes.
could have found the money.
Yes.
But I remember being quite surprised at that. And he says, oh, yeah, I do a few surgeries on the side.
Wow.
But they have to be, I don't remember the context of it all, but I remember being quite surprised at this. I did not take up that offer, and I waited. And I think I had my surgery within 6 weeks. So that was my first experience
is
with pain.
not bad.
No.
Right? Yeah.
It was okay back then. And I was
Wow.
28. I
Yes.
was a lot younger, a lot fitter, and didn't have
Yes.
the house and the kids to take care of. Let's go forward 30 years.
So effectively, we have moved from a 6-week wait, right, to a 3-year wait.
Yes, and a different surgery, but the same,
Yeah.
an orthopedic surgeon did that
Yes.
surgery. So now, let's fast forward 30 years. So it is the first knee I'd operated on
Yes.
that I need fixed. And that physician back then had said, this will happen
Yes.
to you. I just ignored it because I was young and
Yes.
foolish. So 30 years later, I've been given about a 2 to 3 year window.
Mm-hmm.
I am also looking and have been researching, as you know, what it would cost
Yeah.
to pay for this.
Yes.
So my research is quite preliminary
Yes.
because I've been getting referrals and talking
Yeah.
to people. And my physician, my family care physician even said, now, let's get you in the system. Let's get this looked at, because I was in such a state 6 months ago. And she says, now I do have patients that are paying for this. I said, okay, wow. There was the conversation again.
Yeah.
So today, for me to have the knee operated on 30 years later, I have to leave the province. So we have private orthopedic facilities coast to coast in Canada. Well, I think primarily I've been looking at the ones in Ontario, Quebec, Alberta, and BC. But as an Alberta resident, I would have to leave the province to have the surgery elsewhere in Canada, because I think that does not contravene the Canadian Health Act. And so far, my research of talking to people and being online, I have not had a quote in writing, but I have spoken to people, and $60,000 in Canada.
Wow.
If I want to get my knee replaced, and I can do it on my timeline.
So basically you have two options. One is you wait for 3 years, get it covered completely free, or you pay $60,000 to get the surgery done right now.
Yes, on my schedule. There is a third option I will point out. That is leaving the country.
Oh, so you can leave the country to get the surgery done.
Yes, and Albertans in particular go to Europe, parts of Europe, where the surgery is done. And I've talked to one person that's been very successful doing that. The cost was far less. But then, of course, there's more travel, a little bit. It's a little more stressed. She did not take a family member with her. And, of course, going south into Mexico. I do know some people still heading in to the States for surgery, but not as much since the trade war has started. So I leave that out of the conversation for now. But there are people that might still opt for that. So there's actually 3 options.
So
waiting,
getting
Canada,
the surgery done
is,
in some other province,
which is the most expensive option, and then leaving the country. And in the meantime, I've had other situations arise with the joint, and so I am dealing with complications.
So like, just to double down on that, like, what is the experience living with the pain? Like, does it have impacts on mental health, physical health, quality of life, finances?
Yes, so I've maxed out all my healthcare at work.
Yes.
So I cover
holidays,
out of pocket. Well, I've covered my out of pocket costs now. I also I have some flex time. I'm on a flexible work schedule, so that's making a difference. So I feel for people living with this and trying to adjust with it that don't have that flexibility. It would be extraordinarily stressful.
So it will hit your pocketbooks.
This will hit my pocketbooks. If I had to quit working, it would hit my pocketbooks. I feel that I've had to shift my budget to cover more healthcare. And I knew that would happen as I aged, but not so quickly.
Wow.
Because I'm relatively fit and active. And but for me to have the same quality of life I had, I've had to step that up a bit. I also think there is a mental health drain. So our psychological counseling is not considered an essential service. So that is paid for out of pocket. We have some coverage with our employer plan, but that also has some limits. And there's just a whole lot of different alternative medicines. I've been going to a lot more physios. I saw a functional person. I've had to learn to shift how I walk. I've had to get some different shoes. I've had to have massage therapy differently than before. And so all of these different kind of supports come in that are not covered by, many of them are not considered essential services. So if I didn't have an employer plan, and I didn't have flexibility to work, and let's say I didn't have savings to draw on, it would be just, the cost would be through the roof, I think. And that is even before having the surgery, because of the supports needed afterwards. So this has been quite eye-opening, and realizing that the healthcare that I access today is very different than 10 or 20 years ago, and the things that concern me are different.
So just to like explain to people, because you said it while you were talking, that along with healthcare from our provinces, we also have health plans from our employers.
Yes.
So they cover like things like physio, like not entirely. They can cover things like physio, dental, right? Then let's say time off of work. There are certain like long-term disability plans, like short-term disability plans that some employers provide. Not all employers provide.
Exactly.
Yeah.
Yes.
So like let's say you're sick and you cannot work, or you're waiting for the surgery and you cannot work, right? Then that it can be short-term disability, then long-term disability. So the employer can cover those plans. So people who are listening, do check with your employers if you have such plans, right? It's a good idea to have them.
And that is why when we're working with our students and people are new to the country, understanding that those extended healthcare benefit plans have a real value to you.
Yes.
But they also have their limits as well. And every employer is different. So you need to make sure you understand all the nuances of those items, especially for you with your young family. You will be using healthcare in a very different way than I am today as part of this aging population.
Yes.
And I'm in a fortunate situation that I have been able to have access to those extra supports, but it is not my normal. It is in no way what I was expecting as I move into my 60s. But as I reflect back on it, I think I was probably naive to think that it wouldn't shift. I just think I walked into it quicker than I expected. And having aging parents in my life, I see the challenges and the way that we access system for any one of my parents. I still have one with us. We have one with us. And we're fortunate, but we're aware. Think about the people that don't even know about access to all these services.
Absolutely.
And so not only is my expectation for my own healthcare shifting, it will shift for you. It will shift from what you knew growing up to you being a parent in Canada.
Yes.
And I just think making sure that you ask questions or know where to even go to ask the questions so you can create your normal today, because it is different from other countries. It's even different from the 1960s and 70s, and we're going to continue to see it change. I believe that we're in for a real big disruption in our healthcare system, not just because of changing medical technologies and everything, but because we're going to need to structure healthcare in a different way with aging population, brain drain, and all those things I know that we'll talk about in future rants. But it is not my norm, and so I am creating a new normal today.
So absolutely, like our new normals have shifted a lot. From a 6-week wait to we have gone to 3 years of wait time, and it is increasing because of brain drain, adding population and whatnot. So a quick like discussion for you, like what is the solution?
The solution for me, in my state of life, for my generation, I am looking at how I can be more in charge of my health.
Mm-hmm.
So I am researching and asking more questions and looking at alternative medicines and interventions. I think one of the solutions is to grab hold of how my budgeting is going to change at this stage of life. I will have to put money aside for extra health care beyond our employer plan, beyond our healthcare system. I also think, to be realistic, to be more preventative. I have another knee that I've been told, just using this as one example, I will be able to delay the onset and progression of the other knee towards such a bad state. And so I'm going to take that on now and make those changes. So I think for me, it's some of my solutions, and for anybody, is to take charge of your health. Don't underestimate value of education, nutrition, from a holistic perspective. Look at where you're at in your career with your benefits. If you're looking to do a late career shift to a new industry, I would say really look at all of it, your entire total rewards package. I'm not sure I would switch jobs today without an extended healthcare benefit package, for example. But everyone's situation is going to be unique. And I think be open if you are in a situation to look outside our province and our country. Not because I'm necessarily going to leave the country for the surgery, but because I know I'm more comfortable knowing my options. Which, as before, I would say 20 years ago, I had family members who were or waiting for surgery. We would not have looked outside of the country or even outside of the province. You would just wait till your name came up in wherever you were living.
Yes.
I think we have to be more open. I'm not sure that's going to solve the wait time, but it is something that I can do in the short term to take a more proactive approach to my health.
Yes.
And I will change the way I live and interact. I have changed my vacations for the fall already, knowing I won't be able to do what I used to be able to do. But I'm still very grateful for having the ability to have a vacation, for example. I think more than anything, my solution is going to be to change my mindset. What I need today is very different than what I needed 20 years ago, and our healthcare has not shifted enough, or I also have to understand the limitations of our healthcare system and work within what I have. So it's not a solution, but it is how I will cope and manage with the new reality and the new normal I have. And I'm curious about you, knowing what it was like for me raising Benjamin. What is it like for you as a new parent and with your young family? How are you going to manage through?
So what, in terms of solutions, what I see is like I put the healthcare system on 3 pillars right now. So one is provided by the province, right? Okay. It's not perfect, but it is a backstop. So if I get a heart attack, I know that I will be taken care of, right? If there is an emergency, right, they would handle that.
You will be triaged to the top.
Triaged to the top. So that takes care of that. Then I would also not work with an employer who doesn't have an extended health plan, because physiotherapy, right, after like medications, pharmacare, all of that is taken care by the extended health plan. So that's the second pillar. The things that province doesn't handle is to an extent taken care by the extended health plan given by my employer in Canada. The third pillar that I'm looking at and I've started to work on is having an health insurance internationally. Look at some country. It could be Turkey. It's well known for medical tourism. Mexico is well known. India is well known for medical tourism, right? So have a health insurance plan that covers you there, only for things that are not covered by the pillar number A, like the province, the pillar number 2, the extended employer. The third thing, like elective surgeries. For example, if I have to go through an elective surgery, I broke my hip, I broke my, like, let's say knee, right? And I have to get the knee replaced. Now, to wait for that long in Canada, it's not reasonable for me, because it impacts the quality of life. It impacts relationships. It impacts, like, you're tired all the time. Like, I can see the difference in you. So the third pillar I'm adding to my personal strategy is to have an international health insurance. So how it works is you pay a small premium. We are a young family. All of us are like me and my wife are in our 30s. The kids, the premiums are very low because they're very young, right? So I am in discussions with international health providers like in India, right, who would cover those surgeries if need be, right, there, right? So if I break my knee, I can fly out to India, get the surgery done, come back and rehabilitate, like, in Canada. So having that option is what I'm starting to go towards.
That is interesting, because that is something as well. When I was raising my family, I would not have even considered it.
Yes.
And yet those options exist today. And I do want to make a point, just to go back, is that if you had a knee issue today or a
Yes.
broken hip, it might be a chronic condition, but not crisis, right?
Yes.
And so it would be considered maybe elective.
Yes.
But if you were in a terrible accident, you
Yes.
would,
For
but you're
sure
right.
be covered.
But,
Yes.
but if you were living with it and
Yes.
were given even a year
Yes.
with your lifestyle, I'm sure it would even impact you more.
Exactly.
So, and do you think that's affordable for the family today?
Yeah, so the
you're going to
quote-
build it into your budget.
So the quotes that we have received as a family,
Yes.
it's less than $100, right? And
Per month?
Yeah, for like it's a 30-year plan, so it covers us for the next 30 years. Because we are young, the premiums are low, right? And it covers like health insurance, like $100,000 health insurance in those countries, and $100,000 go a long way, right? Like in India, knee replacement is 7,500, like to 10,000.
$7,500.
To $10,000 to get a knee replaced, right? So it is like significantly lower than what the cost is out here. So we think $100,000 should be enough, but this is what like our new normal has shifted. It's not the healthcare that it was, let's say 30 years back. So we have to adapt to our new healthcare.
Yes.
So the new healthcare, the third pillar is going to be more important. We live in a globalized world. Healthcare is available globally.
You have a lot
right?
of family and supports in
Exactly.
India. So
So-
going over there to visit and then
Yes.
being cared for would be
Yes.
quite natural.
Exactly. So people who come from international background, maybe you're from Mexico, maybe you're from Europe, do have some healthcare plans back home. Take a look at it, because even though our healthcare system is good and we all are proud of it,
Yes.
it's not perfect. It has these like challenges that we discussed today. So it's important to think about how you will mitigate that risk.
Yes. And how you mitigate it will change depending on the life stage you're at, your age,
Yes.
and your own unique situation. For me, I think looking at international insurance probably might not be as advantageous, but I think I'm going to look at that now as an option. I'm not sure if I would even get covered because of my age, but for a young family, what a great idea.
Yes.
And to build that into your budget, because one of the things I know that we all have to do is create a budget line for our healthcare.
Yes.
And I think back in my 20s or 30s, I don't think I had extra costs in there for those.
No.
And I just relied on our medical system, our healthcare system, and didn't need a lot either, even through pregnancies and raising my children. But today I build in that line for different reasons, but so have you. You've
Yes.
built in that budget line
Yes.
to account for that, and I think that's one really great solution. And it will be continually to shift in Canada, I think.
Absolutely.
It's not going to stay the way it is.
Yes.
It will continue to evolve, and not necessarily in the ways that we want it to.
Exactly. So, like, socialized medicine is going to have challenges in Canada. So, our new normal has shifted. Just to segue into the next topic that we are going to have a discussion, we are going to discuss next about the new retirement, right? So, does
Yes.
healthcare impact retirement, like the plans that you had for your retirement?
Oh, let's not get started on that now. But I will say that I've decided to call it the new refirement. And so let's leave that on the table for our next rant discussion, and maybe there will be more to rant about.
Sure. Thank you everyone for listening. See you in the next one.
Hope you
Bye.
got some good nuggets of
Stay healthy.
information. Stay healthy.